Here is a comprehensive and detailed explanation of Flumazenil. Hashen, generic name, drug class, drug forms, brand name, generic name Flumazenil, drug class, benzodiazepine antagonist, drug forms, injectable solution for intravenous IV use, concentration 0.1 milligrams per milliliter in 5 milliliters or 10 milliliter vials or ampoules, brand name Romazicon, most common though discontinued in some countries, generic versions available under the name Flumazenil. 2. Definition. Flumazenil is a medication used primarily to reverse the effects of benzodiazepines, especially after surgery or in the event of a suspected overdose. It acts rapidly and is administered intravenously in a hospital setting. 3. Mechanism of action. Flumazenil is a competitive antagonist at the benzodiazepine binding site on the GABA-A receptor complex. It works by blocking the action of benzodiazepines, e.g. diazepam, lorazepam, midazolam, preventing the enhancement of GABA activity, inhibitory neurotransmitter, rapidly reversing sedation, respiratory depression, and psychomotor impairment. Note, it does not reverse the effects of other CNS depressants like opioids, alcohol, or barbiturates. Uses: reversal of conscious or general sedation induced by benzodiazepines, management of benzodiazepine overdose, diagnostic aid in unexplained coma or CNS depression, suspected benzodiazepine etiology. 5. Indications: postoperative reversal of sedation from benzodiazepines, intentional or accidental overdose of benzodiazepines, suspected benzodiazepine intoxication contributing to CNS depression. 6. Contraindications: hypersensitivity to flumazenil or benzodiazepines, patients with benzodiazepine dependence, risk of severe withdrawal, including seizures, use in tricyclic antidepressant overdose, increases seizure risk, patients with history of seizures, patients who received benzodiazepines for status epilepticus or increased intracranial pressure. 7. Before taking this medicine, precautions. Discuss with your doctor if you have history of seizures or epilepsy, chronic use of benzodiazepines, risk of withdrawal and seizures, history of panic disorders, can trigger panic attacks, liver disease or hepatic impairment, head trauma or increased intracranial pressure, pregnancy or breastfeeding, currently taking antidepressants, opioids, or antiepileptics. Pregnancy category C, use only if clearly needed. Lactation, caution is advised. Unclear if flumazenil passes into breast milk. 8. How to use, only used intravenously, IV, in a hospital or clinical setting. Administered by trained healthcare professionals. Injection is given slowly to allow for assessment of clinical response. Continuous monitoring of vital signs, respiratory, cardiac, neurological is mandatory. 9. Dosing information. Adults, reversal of sedation. Initial dose, 0.2 milligrams IV over 15 seconds. If desired level of consciousness not achieved, give additional 0.2 milligrams doses at 1-minute intervals as needed. Maximum total dose, 1 milligrams. Usual total dose, 0.6 to 1.0 milligrams. Adults, benzodiazepine overdose. Initial, 0.2 milligrams IV over 30 seconds. Repeat, 0.3 milligrams after 30 seconds if no response, then 0.5 milligrams every minute up to total 3 milligrams. Max dose, 5 milligrams, rarely required. Pediatric patients, overdose or sedation reversal. Initial, 0.01 milligrams per kilogram IV over 15 seconds, max 0.2 milligrams per dose. Repeat, 0.1 milligram per kilogram at 1-minute intervals, max 0.05 milligram per kilogram or 1 milligrams total. 10. Missed dose and missed dose, not applicable, single dose, emergency use medication under clinical supervision. Overdose, symptoms, seizures, anxiety, agitation, tachycardia, emotional lability, management, supportive care, benzodiazepines for seizures, airway protection. Step 11. Stop or avoid taking. Stop or avoid flumazenil if the cause of CNS depression is unknown or mixed drug overdose. The patient is benzodiazepine dependent. The patient has tricyclic antidepressant overdose. Seizures or severe agitation develop post-administration. 12. Side effects in detail. Common side effects: dizziness, nausea or vomiting, flushing, headache, agitation, tremor, fatigue. Serious side effects: seizures, especially in patients with co-ingestion of antidepressants or with a seizure history. Arrhythmias, e.g., premature ventricular contractions, panic attacks or acute anxiety, abnormal vision, blurred vision or visual disturbances, hypertension or hypotension, withdrawal symptoms in dependent individuals, sweating, palpitations, anxiety, convulsions. 13. Vital information. Flumazenil has a short half-life, 40 to 80 minutes. Resedation is possible with long-acting benzodiazepines. Always monitor for resedation, respiratory depression, and seizure activity post-administration. Does not reverse respiratory depression from opioids or alcohol. Must be used cautiously in mixed drug overdoses. 14. Other drugs will affect increased risk of seizures or adverse effects when combined with tricyclic antidepressants, e.g. amitriptyline, nortriptyline, anticonvulsants, other CNS depressants, e.g. alcohol, opioids, barbiturates. MAO inhibitors can intensify CNS effects. Note, flumazenil reverses only benzodiazepine effects, not those from opioids, alcohol, antipsychotics, antihistamines. Thank you. Have a nice day.